Air is the enemy.
Hi, I'm Dr. Randall Stenowin, and I want to welcome you to Houston Medical Imaging. Your doctor has ordered a prostate MRI. Possibly, we may be looking to diagnose a prostate cancer. You may have been diagnosed with prostate cancer before, and we need this for staging purposes, or perhaps we're just following you because you don't have an aggressive lesion. The beauty is that we at Houston Medical Imaging have a high-field 3 Tesla magnet, which will enable us to get high-quality, high-resolution images without having to use an endorectal probe. In order to get the best images, we need your help. And that help is fairly simple, but I want to explain it so that you understand exactly what we're talking about. First of all, it's important that you abstain from sexual relations for 3 days. I want to show you an example of how important it is for you to have a good prep. Air is the enemy of quality. And when we're trying to get high-resolution images of the prostate, that's why that Fleet enema is so important. We recommend that you use the Fleet 60 minutes to 90 minutes prior to examination. Follow instructions, insert the tip into your rectum and expel the contents. Wait 5 to 10 minutes and then use the restroom, trying to empty your rectum as best possible. Just prior to the examination, the technician is probably going to ask you to try to evacuate again. If you feel like this is of any use at all, please attempt this. Here's an example of a patient who was unable to empty the air and fluid from the rectum. What happens is that you lose the margins of the prostate, you lose the fat planes between the rectum and the prostate, which might obscure small cancers. This patient was able to effectively empty his rectum, and you can see how sharply defined the prostate is, how easy it is for us to pick up pathology. Again, just to reiterate, air is the enemy of high-quality prostate imaging, and that's why it's so important you take your probe. Try to expel the Fleet enema and any gas as effectively as possible, because it's going to enhance the imaging quality at the end of the day. Once you arrive at Houston Medical Imaging, you'll fill out your paperwork. We'll put you on the scan, and we'll do a number of sequences in order to cover the pelvic area. 30 minutes into the scan, we're going to inject some contrast. That contrast, performed with dynamic imaging, will enable us to see if there's any enhancement either within the tumor or outside of the prostate to facilitate diagnosis. Once the images are complete, the radiologist will review the study, will process it using a separate DynaCAD program, and then we'll send both the report and the image sets to your doctor for review.